So here we have a little routine in regards to elbow pain. Now, elbow pain, the reasons for elbow pain can vary quite massively, but in my experience, there's always a few areas that generally show up that need a little bit of TLC. And these are the three things that I feel can help pretty much anyone suffering with any kind of elbow pain. Now, the first one is self-myofascial release. Now, all of this is, you can think of it as self-massage. Now, in the forearm, there's obviously a lot of tissue and a lot of muscles there. And nowadays, especially people at computers, on their phones, more often than not, or a lot more than we used to, the tissue here can become quite tight. So what I want you to do, and you can use this just with your own hands, you're gonna kind of press and palpate, and what we're looking for is a nice kind of soft density. You're looking for areas that feel quite a little bit, you could say a little bit harder, a little bit more dense. Once you find them areas, I just want you to rub along it gently. This is just to kind of get a little bit more blood flow to the area. Again, take about 30 to 60 seconds kind of self-massaging. Now here comes the self-myofascial release technique. On the area of denseness, I want you to compress to about 6 to 7 out of 10 on discomfort. From there, keeping the compression, I want you to very subtly drag the skin upwards just to a point before it can't go any further. And the aim is to keep the level of tension or pressure, but then keep that little stretch, should we say. Now, bring your awareness to how that feels, because this is going to be important, because this is going to tell us when to bring our thumb off that position. So I want you to start to feel when that area becomes a little bit softer. Now, bear in mind, we are working with the fascia, so this can take anywhere between 60 seconds and 5 minutes. So nice controlled breathing into this one. By all means, put the TV on, read a book as you're doing it, whatever you want to do. But as soon as that tension starts to release, you slowly ease the thumb back and take off. Then you're going to go to the next bit. No more than 3 or 4 areas that you're going to work on with this. This is going to help create a little bit of relief for the tightness in these muscles. Now, this is all about creating space in the tissue. Now, the next thing we want to do, we want to add a little bit more stability to the area. Now, all you need for this is a small little weight. It can be a small dumbbell, can be a handheld weight like this. Now, the first one we're going to look at is all about supination and pronation. All that is, resting your hand down on a table like so with the weight in hand. You're going to rotate the forearm one way, which is what we call pronation, nice and controlled, and then we're going to go into supination. Now, with movements like this, it's very easy just to kind of go through the movement. What I really want you to focus on is feeling the muscles working. It's nice and controlled. And with this, 1 repetition is over, back, and in. I want you to aim for about 20 to 30 repetitions of this. So this is pronation, this is supination. The next one is about flexion and extension of the wrist. Now for this one, you're going to want to do this kind of with your hand resting over the side of a table. But I'm going to use my other hand as like a prop, just so you can see. So from here, we're going to go into wrist flexion, but you're not going to force it, just go to where it feels natural. This is flexion and this is extension. All these movements are done very, very slowly. And again, 20 to 30 full repetitions of this. Try and do this every day, because this is something that's going to help take away tightness. Remember, all the tightness in the forearm, it links directly to the elbow. So we want to kind of get rid of that tightness, these little kind of fascial knots, should we say, and then we want to bring about more of a kind of an increased endurance-based loading through the tissue. Remember, we're looking at the type 1 muscle fibers, which are all about postural endurance and structural integrity. So give that a go, and as always, if you have any questions, feel free to ask away.